I
Member
have
De Los
a
Santos.
manifestation on item number 13.
Go ahead, Member De Los Santos.
With the reported actions taken for dengue prevention campaign, yet there was a quantum leap of cases from 283 of July 2024 to 790 in August, and worse is the 1,065 in September. However, it may become a nightmare for the city if not controlled, with the cases of 255 in just 3 days for the month of October. What were the factors that contributed to the skyrocketed cases and incidents of dengue in the city? As gleaned from the table presented, there was no reported dengue mortality for the last 5 years, from 2019 to 2023. However, as of September this year, there were 11 confirmed dengue deaths already. How intensive the city's current campaign against dengue compared to the last 5 years when it has no reported death? Well, this year, it has already 11 confirmed dengue deaths. As shown from the graph, the dengue cases this year is 394% higher compared to the same period in 2023. I repeat, the dengue cases this year is 394% higher compared to the same period in 2023. In fact, with only 4 suspected dengue deaths, while as of September this year, there were 11 confirmed deaths of dengue. Have we evaluated the barangay's dengue campaign program and collaboratively work with them to intensify the city's dengue campaign program? Mr. Chair, I may sound emotional, but I am indeed agitated because based from the reported data, 70% of the confirmed dengue deaths are helpless individuals ranging from 3 years old to 12 years old, while there was an elderly with the age of 75 years old who succumbed to death because of dengue. The disposal of resources and the management of cases are within the reach of the City Health Department insofar as the department is so established to take charge of the city's health programs. Yet, Mr. Chair, somehow, somewhere, the city falters. In conclusion, Mr. Chair, the case fatality rate, the incidence rate, the number of dengue deaths against the population perhaps may not have a very significant impact for the majority of us, but it has a great impact to the family and relatives of the victims. Most of the victims and would-be victims, God forbid, are the vulnerable populations, the very young and the very old. It may just sound as simple as it may appear because the vector is a mosquito, but it have a devastating effect to the lives of the vulnerable people. It is not so much about the quantity of cases, but it is about the quality of life this city could provide to the Cebu City residents. It may sound personal to some, but indeed it is personal to me because it involves the death of the helpless, the powerless, the weak, and perhaps the marginalized sector of our society.